You know, one of the things you might not think about when someone is cancer-free is that they're often left with daily reminders of the disease, and that, of course, comes in the form of scars that they see all the time.
That's right. That's why a Prior Lake woman decided it was time to erase what her cancer had left behind. TCL reporter Kelly Hansen takes us to Bashioum Cosmetic Surgery Center in Wayzata for the story.
And I think to help you feel better about yourself and feel more symmetric one side to the other, those are all important things.
Kristina Singer from Prior Lake is a mom and a two-time cancer survivor. First diagnosed with lymphoma, years later in 2009, she was diagnosed with breast cancer.
You know, I get used to all my scars. I had lymphoma in '98, and so that has more scarring on my chest, and this will eliminate a lot of that. This will make it fuller and prettier, and I will feel more confident.
She's here at Bashioum Cosmetic Surgery Center to fix what surgeries and most recently a lumpectomy left behind.
They did a lumpectomy on one side, and it left quite a dent.
She came to us wanting to have larger breasts, wanted to improve the appearance of the breast cancer defect that she had on her left side, and she wanted liposuction. So it's an ideal world. We're able to take fat from someplace else in her body, transfer that into her breasts. Her hips will look smaller and her breasts will be fuller.
When he told me about being able to use my own fat to put it back in, I mean, we used to joke about that. Why can't they take it from one area and put it back on the other? So this is actually a huge answer to prayer. It's just, I'm excited to do it. It's a huge blessing.
Dr. Bashioum is taking fat from several areas of her body.
And it's your own tissue that's actually living and breathing.
The fat grafting procedure will make her breasts fuller and will also smooth out the indentation on her left breast.
This is a restorative kind of procedure where you're transferring stromal cells and stem cells, and those cells really rejuvenate the skin.
This body has been through a lot, so to be able to continue on and look good and feel good and to just continue to run and play, and yeah, I'm excited.
This is very exciting. Dr. Bashioum and Kristina are
Look at
here
that smile.
now. I mean, how are you feeling now after all of this?
Great.
Yeah.
Fabulous. I feel really good.
Okay, we want to see the before and afters, okay? So let's take a look, because you had this surgery in early September. So let's take a look at some of the images here that you're seeing, and you can see that indentation, and that's what was bothering you, Kristina.
Right.
Yeah, and so every day, this is what you see. And did it feel like a constant reminder?
Well, yeah. I mean, yes.
Yeah.
I mean, I felt pretty as a person, as a woman, but I'm also a single woman. So you think about those things, that you're going to be intimate with somebody, and there's always a comparison to other women. And now, I mean, not to mention the health issues. Yeah. I mean, I know that I am very lucky and fortunate, for so many breast cancer survivors have not survived. And so, excuse me. Oh. And no, I'm thankful that I'm around, and this is an amazing procedure. I feel beautiful now. I mean, like I said, as women, we are beautiful anyway, but to have it confirmed every time I look in the mirror, it's very awesome.
Oh, I love that.
Now, Dr. Bashioum, talk about this too, fat grafting. This is, I mean, it's still a rarity, really.
Well, it's not common that people are doing this, but more and more it's been shown to be an effective way to care for patients. Now, in Kristina's situation, she had not only the lumpectomy scar, but she'd also had radiation. Sure. And the idea about fat transfer really helps rejuvenate radiated skin. And there's always radiation damage to the skin, so that's the ideal situation. And to touch on what Kristina said, after a woman has gone through a horrible situation like this, a terribly scary situation, life-threatening kind of a thing, to have that scar to remind you of that every single day is very hard. And we're just trying to get past that. Now, granted, she's past that, but to see that scar, you're in the back of your mind, you're thinking of that, and that's what the real joy of this is.
Do you think that this is the future, this idea of taking fat from one place, which we have all joked about? When you joked about that, I was like, okay, we've all said that. Every woman has said that. Can't we just take the fat from one place and put it into another, more useful place? Is this going to be the future of implants and augmentation moving forward?
Well, I think so. And you know, in our office, we're doing more fat transfers for breast reconstruction in immediate fashion. So a woman has her mastectomy, she has a fat transfer immediately, much easier convalescence, much easier transition, and she can have her reconstruction without implants. So I think really it's going to be the wave of the future for breast reconstruction and for breast enlargement for certain women.
Well, I would just think too, Kristina, with that idea of cancer, which seems to me like a foreign something attacking your body, to know that you are having something to repair this that isn't a foreign object, I think would be really nice to know.
Oh, right. Yeah, my fat has been with me for a long time.
Oh, my my gosh.
Hey, and something really worth celebrating, 5 years cancer-free.
Yeah.
That's
We
awesome.
love hearing that. Thanks, Kristina,
many
and
more.
thank you, Dr. Bashioum.
You're welcome.
So you can call Bashioum Cosmetic Surgery Center to schedule your consultation today, and if you have any medical concerns, you always want to consult your primary physician first, and we've posted more information at twincitieslive.com, and we want to thank Bashioum Cosmetic Surgery Center for sponsoring Twin Cities Live. Nice to see you.